have any questions, just direct them my way. Thank you for joining us.
Thank you. Hi, and welcome everybody. I actually have lost my notes, so I've got my written chicken scratch here now, but welcome to the We Are MENA, a call to action webinar hosted by the AMENA-Psy Student Committee and the We Are MENA Campaign Committee. We really appreciate you being here with us for this really important conversation today. My name is Bahar Amini, and I am AMENA-Psy student member at large. AMENA-Psy is a fairly new but growing organization, and we are one of the 5 national ethnic minority psychological associations in the US. And as part of my role, I get to lead an awesome team of students known as the Student Committee. This group was created for psychology students who either identify as MENA or are interested in MENA-related psychology topics. We formed the Student Committee in 2019 as an innovative group that's committed to building a strong community to support its student members. But more importantly was to create a professional home, a space that did not exist before AMENA-Psy, and as Arab and MENA students are not recognized as a distinct ethnic minority group in many of their contexts. Since 2019, the committee has expanded to include several subcommittees, including the research chair position in which the We Are MENA campaign committee has grown from. This is led by our research chair, Sarah Al-Saidi. And this again stemmed from a space and recognition that we are often left to advocate for ourselves and for the inclusion of MENA people in the research and in our spaces. So without further ado, I would like to introduce you to Sarah Al-Saidi.
Hi, everyone. It's so wonderful to be here. Thanks so much for joining us. This is so exciting. So first off, I just want to welcome everyone and just shout out our wonderful speakers, Dr. Awad and Dr. Kia-Keating. We're just so grateful for both of you for sharing your knowledge and for your willingness to support us in this advocacy campaign. I also want to introduce you all to the We Are MENA, the faces behind the We Are MENA campaign committee. So this is Rebecca, Naha, Zaina, Atma, and Mary. These beautiful faces here and these beautiful people here have worked so hard to develop all the materials and work together to create this campaign. We're all graduate students at different levels of different universities, each of us sharing some aspects of our identity with MENA. And really feeling, we sort of came together initially, really feeling invisible in each of our programs and each of our experiences, looking through the literature and really wanting to bring attention to this issue. And that's kind of where the We Are MENA campaign grew from. We can go to the next slide. I want to just talk very briefly, just about who we are, what is We Are MENA about, and why is this important? And then we're going to allow our speakers to basically take it away and answer any questions towards the end. And so what is We Are MENA about? The idea really came after, the budget cut and the failing of the US Census to include a MENA category at the time. And so we really sort of at that moment started to think to ourselves, we don't want to wait another 10 years without having MENA included in research. As we know that there are various negative consequences as a result of this. And so it sort of exacerbates the invisibility of this marginalized group. And so we really wanted to bring attention to MENA people in research and also advocate for the simple inclusion of MENA in demographic categories. I think this started in our own personal little bubbles where, I would talk to my friends and say hey, you should include MENA when you're collecting, demographics for your dissertation. And everyone did. And it was as simple as that. And so we thought that if we just sort of started it that way, that it could sort of just light a fire in everyone and that we can really address this issue head on. Why is this important? Our voices are important. It's important for us to be recognized in all types of health and educational data and social data. And so we want to be counted and we want our experiences to be differentiated and we want to feel like we belong somewhere, that we're not sort of just muddled into another category where it doesn't really accurately reflect our experiences. In terms of our request, there are a lot of documents that really outline very nicely how to include MENA in your research. And our speakers today will sort of describe that in more detail. But the idea is that we're asking for a couple of things. include MENA in your research as a demographic category. Also actively recruit MENA participants and make sure that they're represented in the data. Share MENA research and advocate for MENA inclusion in professional spaces. Read and share professional work, integrate MENA research into the curriculum and teaching, and also visit our organization to learn more and to support us. And so that's really the introduction I really wanted to give everyone. And so I will let our next speaker take it from here. Thanks everyone for being here.
So I'm going to quickly introduce our speakers. I just want to find Dr. Kia-Keating, if I can find her on my screen. Okay, there she is. Okay, and I just want to add her spotlight. Okay, so I'm going to quickly, it is my honor to quickly introduce Dr. Awad and Dr. Kia-Keating. And so Dr. Awad is an associate professor and area chair of the Human Development, Culture, and Learning Sciences program in the Department of Educational Psychology at the University of Texas in Austin. Dr. Awad teaches courses in research methodology, statistics, psychology of women, and psychology of race and racism. She is also affiliated with the Counseling Psychology program. Her research aims to answer questions such as what factors lead to discrimination against ethnic minorities and what impacts perceptions of experienced discrimination, as well as predictors of prejudice toward Arab Americans, individuals of Middle Eastern descent, and other minority groups. She has published in the areas of racial and ethnic identity, affirmative action attitudes, and multicultural research methodology. She has published over 50 articles and book chapters and is the co-editor with Dr. Muna Ahmed of the Handbook of Arab American Psychology. Her op-eds have appeared in USA Today, Fortune, Al Jazeera America, the Houston Chronicle, and the Austin American Statesman. Dr. Awad is one of the co-founders of AMENA-Psy and is currently the president-elect of AMENA-Psy. She has served as the inaugural MENA Arab member at large for APA Division 45, which is the Division of Culture, Race, and Ethnicity. Dr. Awad is the associate editor of Cultural Diversity and Ethnic Minority Psychology and has served on the editorial boards of the Journal of Black Psychology, Psychology of Women Quarterly, Women in Therapy, and the Journal of Multicultural Counseling and Development. And we're very excited to have her. I want to introduce Dr. Kia-Keating, who is the professor at the University of California, Santa Barbara, and Gurvitz Graduate School of Education, Department of Counseling, Clinical, and School Psychology. She is a licensed clinical psychologist, and her scholarship focuses on promoting resilience and thriving among children, families, and communities facing toxic stress, adverse childhood experiences, and collective trauma, including war, mass violence, and climate change-related disasters. Dr. Kia-Keating's research has been funded by NIH, and she has been published in the Journal of American Academy of Child and Adolescent Psychiatry and the American Psychologist. Her interviews on significant psychosocial topics such as violence and mass trauma are ways to build youth resilience are published in the Washington Post, ABC News, and CNN. She developed an expertise in childhood traumatic stress through her work at the Yale Childhood Violent Trauma Center and the Center for Refugee Trauma at Children's Hospital, Harvard Medical Center. Dr. Kia-Keating has worked with displaced populations, including those from Syria, Somalia, Sudan, Sierra Leone, Kenya, Iraq, Iran, Afghanistan, Mexico, El Salvador, and other locations around the world. She utilizes participatory and human-centered design approaches to empower communities and form multi-sector collaborations to find initiative solutions to public health challenges and to reduce disparities. She served on the American Psychological Association Task Force on the psychosocial effects of war on children and families who are refugees from armed conflict residing in the United States. And so now, without any further ado, I'm going to pass it over to Dr. Kia-Keating.
Thank you so much. What an introduction. I really appreciate that. And also I'm just so excited and happy to see all of your faces here today. And I wanted to especially thank this amazing committee for putting together this time to talk about such an important issue, and the campaign and the amazing amount of kind of grassroots powerhouse effort that you all have made. So I really thank you all for your efforts. And this is a wonderful group to be part of. So thank you all, those of you who are participating today. And I have been kind of embracing and appreciating the fact that we're all on Zoom, even though it would be so much fun to be together, because it just also allows this access to just sit in our living rooms and turn on our computers and join with a group all over the country and connect. And so thank you for those of you who have written welcomes and hellos in the chat. And so I wanted to invite everybody for a moment to just say a quick hello over chat. And I wondered if you felt comfortable sharing on chat your heritage. So was it you? Was it your grandparents? Who came over to the US and where'd they come from? We're talking about identity today, and I'd love to see who's in our audience. So if you want to just throw in a little hello in chat, it would be fabulous to see who we have among us. So it's exciting to kind of see the diversity and the array and our wonderful kind of community here. So thank you for sharing that. Love to see those.
We've got quite the diversity, Miriam. We've a lot.
I'm seeing it coming in and I love it. Yeah, it's fantastic. Great. So as people still, and I know a few people are mentioning that they're not MENA. I'm still wondering where your ancestors are from. So please feel free to share. You still have a heritage that's important here. So I'm loving the MENA people who have joined in, and I embrace and so appreciate all the allies who are here today too. So I thought I would start with, actually, as these come in, and it's so much fun to see still, I wanted to start with a story because I wanted to just talk about why is this so important, and what are our experiences as those of us in doing the research and doing the work, and but then our own personal experiences matter too. And I thought it was just kind of, this is kind of an interesting, funny story that I thought of when I got asked to speak at this webinar that I thought I would share with all of you. So I actually got asked by somebody to participate in a research study. And it was a little different for me because, you know, you might see a flyer or see an email about becoming a participant in a study, but I actually got approached individually, like somebody asking me, would you be part of my research study as a participant? Can I interview you? And so I felt kind of like, oh, wow, this is sort of like the doctor becoming a patient, right? And I was like, whoa, this is different. This doesn't happen regularly. And I kind of felt a little flattered, like, oh, somebody wants me to be in their study, sure. And how can I say no? I'm a researcher. I'm always trying to recruit participants, so I better say yes, right? So I said yes, and the research was about kind of people's experiences in education. And the researcher said to me that she wanted to get diverse perspectives. So I was like, oh, great, fantastic, you know, sign me up. So we scheduled a time for an interview, and it was a qualitative study. So it was a semi-structured, in-depth interview. And I'm sort of sitting there going, oh, I know what we're doing because I do the other side of this all the time. And I still remember how cozy the room was where we met, and it was kind of like good lighting. It was really like made it intimate and cozy, like you wanted to tell her everything. And the chairs were super comfortable, and I thought, oh, she's doing a really good job. And so, you know, I answered all her questions and did this interview. Well, as all of us know who do research, it takes a while between when you do collect your data and when you finally write it up. But she was great in terms of coming back to all of her participants, and she had probably about 15 or 20 of us who were interviewed. So it wasn't a big group. It was a typical qualitative study. And she came back and said, hey, by the way, I've written it and I wanted to just share what I wrote. So I got a copy of her final thesis. It was a student, so it was like a thesis, and not my student, so there wasn't any kind of strange boundary issue. I didn't otherwise know her at all. And so I got this and I thought, oh, this is funny, because now you kind of realize what participants might go through. The first thing you do when you see that is look for yourself, right? Where am I in this study? What pseudonym did I get? I wasn't asked like to give my own pseudonym, as some people do in qualitative studies. You know, who am I? And I looked in the participants list where she had a nice little qualitative table where she had her pseudonyms and descriptions of each person, and I wasn't there. And I thought, oh, I must have missed myself. Let me reread that. Went through it again and again, a couple more times, and I literally was not included. And I thought, oh my God, did I do a horrible interview? Like, did she not want to use what I said? What happened? But then I thought, no, why would she hand me her final product if she didn't include my interview? She, like, clearly she came back way, months and months and months later. So of course, then I spent time reading the whole long thesis, and it was very detailed because it was a thesis, it wasn't a published paper. So it had tons of quotes. And in reading through it, I looked for what did I say? And I've tried to remember because it had been a little while. So, I started kind of finding parts that I was like, no, that's me. That's definitely me. But the strange part was that I wasn't labeled correctly. She had somehow decided, she never did there was no survey, I didn't fill out any forms. She never asked about demographics, but she had described me as Native American. I was the Native American participant, apparently, in her study. And I'm not Native American, and I've never obviously ever claimed to be. I would never claim to be. So I was sort of startled, and I thought, oh my gosh, what do I do now? And this is a really odd thing to have happen. And I thought, oh, that's why she asked me to be in her study, and why she had approached me. She wanted to have a Native American participant. And it's sort of a random, strange little story, but it relates in that this was a while ago, and there wasn't even awareness. There's not category. And this is sort of in that particular study, she didn't provide an item that said, which of these boxes do you check? She just made a lot of assumptions. But I think it really speaks to this issue that we often talk about with MENA Americans, and has become more apparent to those of us who are paying attention to the place of MENA Americans, is that there's this balance between invisibility and visibility. So what we talk about is sort of sort of between a rock and a hard place. So a hyper visibility when it comes to media around negative events that happen in countries of origin, oftentimes, and come with a lot of stereotypes and racism, and sometimes policies that impact our community, and a complete invisibility when it comes to anything else, especially anything positive or contributions. In fact, when somebody is doing something that's an incredible contribution to the United States, they're often, even if they have a MENA heritage, or even immigrants, as I am myself, I'm an immigrant, first generation, I came over, I became a citizen, and there's not that recognition at all. In fact, you just would never know. So you only know when something bad happens, and you don't know when anything good is going on. So this, of course, speaks to why this campaign is going on and why we're talking about these issues today. So I wanted to just go back a bit, and I was trying to decide if I should kind of share some slides, and I think I'll just show you a few just to kind of follow along, and maybe it's a little bit easier. So let me just share screen with everybody if that works. Okay, we will do that. So let me quickly, all right, so I'm going to just talk a little bit about visibility and belonging. So I wanted to just go back in time a bit and look at kind of the legal issues around what, where these racial categories even came from and how they're used in the United States. And John Turanian, who is a law professor, has written a number of articles and a book called Whitewashed, and I highly recommend all of his work. He has talked a lot about, specifically for Middle Easterns, but also just in general in the courts, when somebody has been labeled white. And the idea of, and this is an article published in the Yale Law Review, I'm happy to send anybody who's interested a link, it's accessible online. And for those of us who don't typically read law journals, it's actually pretty accessible and fun to read about some of the actual cases that have gone on in the courts. And I'll just point to a couple. But I think it's really important to recognize that until 1952, only whites and blacks could qualify for naturalization. And so we actually in the court system only had a dichotomous option. Either you were white or you were black. And many other scholars have also talked about the Irish, Italians, Greeks, Slavs, many other groups that were originally identified under the black category and then fought for becoming placed in the white category. And so there's a lot of scholarship around that. And so this article cites that 52 cases were reported between 1878 and 1952. And in all of those cases, an individual was suing to be declared white by law after being denied citizenship rights by immigration authorities on the grounds of racial ineligibility. So it became part of our court system, our legal system, where people were fighting to be recognized as white. And I'll just highlight a case, an early case in 1942 of Ahmed Hassan, who was an Arab male who didn't qualify as a white person capable of citizenship through naturalization. And the judge actually writes about how there's this wide gulf that separates their culture from that of the predominantly Christian peoples of Europe. And it cannot be expected that as a class, they would readily intermarry with our population and be assimilated into our civilization. So that's in 1942. And we'll jump forward, there's many other cases, but just to have a juxtaposition, this is in 1987, it's a case of St. Francis College versus Al-Khazraji, who was a immigrant from Iraq. And he actually was the plaintiff in this case who was denied tenure. He was a professor by St. Francis College, allegedly on the basis of his racial background. And he filed an action against the college around discrimination. But the college contended that he was, instead of in the older cases where you weren't white, in this case, you are white, and therefore you can't claim racial discrimination. So he had no standing under this particular 1981 action. This case actually went up to the Supreme Court, and the Supreme Court reversed the opinion. So it ended up that he was able to claim discrimination. But you can see that a lot of this fight has happened in the court system, and there's a lot of confusion as to when and where somebody can claim to be white and what that affords us. Okay. So Dr. Awad will talk a lot more about the census itself, but jumping forward to 2020, there's still no category for MENA, as many of you are probably aware who are here. And MENA communities are still positioned in the census under white, right? So there's no way to tell or differentiate this group, and she'll talk a little bit more about that. But I did want to highlight that Dr. Awad and Dr. Amer and I worked on an article in the American Psychologist that got published in 2019. Again, something that I'm very happy to share if somebody doesn't have access. And it's a special issue on racial trauma theory, research, and healing. And why I point to this is because of the question of why this matters. Why does it matter that we need to actually highlight that this is that this population needs recognition, and not just in the research, but the research is certainly an important place to start. And Dr. Awad will talk about more in the public eye and in what the social elements are of actually and impact are of having a MENA category. So I won't go through our entire cumulative racial ethnic trauma conceptual model, but you can see here that we highlight numerous macro level factors that relate to historical trauma, national context, and institutional discrimination, and how that impacts outcomes around belonging, opportunity, and freedom. And then at the individual level has significant implications for fear, oftentimes on a regular basis, if not a daily basis, hopelessness, alienation, and ultimately physical and mental health conditions. And without recognizing MENA descent populations in our research across health and mental health, and then all the other disciplines, we can't even articulate or understand what these implications are. However, my own research, as was stated in the introduction, is around trauma and adversity. And there's just a growing emphasis and just a huge amount of empirical literature on the implications of experiencing trauma and adversity on long-term health and mental health. And so it's really critical, and it's been identified as a public health crisis in our country. And yet we know so little about a group that has many of whom in this population have experienced historical trauma, but then certainly over and above, oftentimes are experiencing present day discrimination, racism, and national policies, hate crimes, and sort of all these factors compounding these experiences of adversity. So it's really a critical area. And these are just a little bit more about from our article, which I won't go into, but I will invite you guys to please reach out if you do want to get a copy and read it more thoroughly. So I wanted to just finally kind of highlight that the APA guidelines on race and ethnicity in 2019 talk about how important it is to really make this effort to include MENA people and address the diversity within these communities, so recognize the heterogeneity, but also begin to really acknowledge and recognize and research include MENA as a category in research. And they highlight that there's little known about MENA groups compared to other racial and ethnocultural groups. The lack of information is especially important to address given the socio-cultural and political context of discrimination that MENA groups face. So that came out in 2019. And each year, APA puts out a report on stress in America. So they have a, APA 2020 report. If you look back, there's a 2019 report every year. You can look at this. And they highlight the impact of discrimination in this past year's report. Of course, there's a lot about COVID. And the amount of stress that discrimination is causing went up from 25% of the sample to 33%, so a third of adults, and this is of any race or background, right? And then they looked specifically of people of color, and they said 44% report discrimination as a significant source of stress in their lives. And that people of color are more likely to report higher stress related to COVID. But if you look closer here, and I don't have all the demographics of their whole study listed here, but you can see in these two little quoted portions, the groups that they're talking about are still white, Black, Native American, and Asian. And they're not including a MENA category. So again, there's no way to determine, there's no specific information, even though in 2019, there's this recognition from our biggest organization, APA, that, hey, we need to look at MENA. There's still no follow through quite yet. So we're at the cusp of really, hopefully all of you being here, each of us can play a role in helping propel forward the fact that this is something that is important and that we need to recognize and incorporate into our own individual work. But even more so, we need to be advocates and ask and shoot that email. It can really be a grassroots effort of asking each organization, each time you see that MENA is not in that category, can you write a message and say, hey, can you include MENA? I'd like to make sure that that group is included. Whether or not you personally are MENA does not matter. In fact, we appreciate the allyship. And then my last thought is just that we do have to remember that race is a social construct. And this is from the American Academy of Pediatrics, highlighting the impact of racism on child and adolescent health. And they really emphasize that humans are 99% the same at the level of their genome, and that we are using this social construct, we're stuck with these social constructs. And it kind of circles back to these legal issues of, we used to just have 2 categories, now we have more, but all of this is just a social construct. So even though I'm excited to be here to talk about including MENA as a category, and this is truly where we need to start, there's still a lot more work to be done. And I hope it's just the beginning of an evolution and a growth. It's urgent to be inclusive in our demographics, in terms of research opportunity, and to create environments where there's inclusion, equity, and belonging. We need to understand more about MENA Americans, but I also wanted to highlight that we can, by including MENA, we can actually learn from MENA Americans. There's a lot to learn from these groups, as well as all of our all groups in the U.S. And if we don't distinguish them, we can't gain from the groups that have come into the melting pot that is the United States. And then finally, let's keep growing and evolving. And I'll just end with a quote again from John Turanian, whose work that is from the legal perspective. And he says, a major step in the dismantling of the racial stratification of our nation will come from explicit recognition by the courts that race is a social construction, not an inherent part of human existence or a scientific fact. Only then will we be able to recognize racial division as nothing more than a subjective and irrational perception that oppresses us all. Only then will our nation set out on the path towards equality for all of its people. And this is from work he did 20 years ago. So I'm very hopeful that we can start this conversation as well as continue this conversation as we go forward. And I will pass this along to Dr. Awad.
Okay, let me share my slides here. Okay, well, first I want to thank the student committee for inviting me to come, and I also really appreciate Dr. Kia-Keating's presentation, and there's going to certainly be some overlap, but hopefully I'll provide you with some new information. And if you're getting hypnotized by my screen, I apologize. Hopefully the bubbles are moving on my side. Okay. So today I'm going to spend some time talking about counting MENA and how to actually include AAP-MENA on demographic forms. So I think before we start in talking about that, we need to talk about why this is important. And Dr. Kia-Keating did an excellent job of highlighting some of the court cases. I'm going to talk a little bit about some of the issues that have happened within the United States that have really led to the racialization of Arab and MENA folks. It really, so when we think, I study discrimination, so I'm always attuned to when discrimination started to occur towards this group, how often it occurs, and the experience of discrimination by Arab and MENA people. But here's the thing, so discrimination towards Arab and MENA people started in the United States when Arab and MENA people came to the United States. Okay. So this notion that all of a sudden this was an issue after 9/11, and that's when it first started happening, is a myth that is commonly perpetuated when we're talking about this group. But when we talk specifically about the racialization of Arab MENA, and when I say racialization, I mean racialization of Arab and MENA as non-white people, okay? So the technical way that MENA people are recognized as within the white category, we know this, but in terms of experiences, this doesn't tend to map onto experiences of many or most Arab and MENA people in the United States, okay? And so this really started in earnest around the 1967 Arab-Israeli War, in which there was media coverage of this war, and Israelis were portrayed as heroes and Arabs as barbaric, right? So then Arabs are set out as the enemy here. Then it starts to also increase discrimination of people from MENA groups, MENA countries rather. Right around this time, you see sort of an increase of experiences of othering and discrimination in the US. Then you have 9/11 terrorist attacks, another surge happened there. And then most recently with the Muslim ban, another resurgence happens there. So this has sort of been around for a long time. And although in terms of recognition, Arab and MENA folks have been rendered invisible, they've been pretty hyper visible when we talk about experiences of discrimination. Okay. So I want to talk a little bit about what has actually been done out there to try to fight for recognition. And I've been really fortunate to be a part of a group of scholars across a lot of different disciplines that have worked with the US Census and other federal entities to try to gain recognition for Arab and MENA folks. So I guess in some ways, I've been in the room where it happens to some extent, okay? And then so I think what's really important is that this fight for recognition is also not new. And Helen Samhan does an excellent job in an article where she documents all of the different measures that have been sort of put forth to try to get an Arab or a MENA box on the census. So in 1993, a congressional subcommittee that was tasked with the oversight of the US Census called for public comments about existing Office of Management and Budget racial categories, okay? And the Office of Management and Budget is a part of the government that sets the minimal reporting standards for race and ethnicity, okay? And so in 1993, they said, look, I think we need to revise these. And part of the revision was actually coming from this notion that we have some groups that don't belong in certain categories. And one of those groups was actually Arab and MENA. Okay. And so around this time, political leaders and scholars submitted proposals for a separate category. And you had two different entities doing this: the Arab American Institute, otherwise known as AAI, and the American Arab Anti-Discrimination Committee, ADC. And both of them actually submitted competing proposals to OMB, okay? And AAI said, look, we just want MENA to be removed from white, just, you know, have sort of a box so that we can disaggregate. And they, at that point, were trying to fight for the path of least resistance, which was not necessarily changing the racial recording standards in terms of who's classified as white or not, but rather just disaggregate the data so at least we can have the data to show that there are these disparities between Arab, MENA, and white folks, right? But the ADC was like, look, we want an Arab American category. Okay, so this caused some issues, and the OMB are like, oh, you look like you don't have your house in order. You have people fighting for different things here. And part of the issue was the Arab American label was thought to be too narrow and left out MENA folks that don't identify as Arab, okay? And so fast forward, OMB is like, okay, you all need to go take care of your business. Come back when you know what you want, okay? So no category was added for the 2000 decennial census. Now, why do we care about the census? You're probably asking, okay, who cares? I don't give a crap what the census thinks about me. Here's the problem. The census sets the standard for how race and ethnicity is collected on every demographic form you fill in the United States. Everything. In doctor's offices, in educational settings, in healthcare settings, political, everything, every realm. So it's important because people are not really thinking too deeply about who's on these forms and who's not. They're just using what the census uses because that's sort of the federal agency that is best equipped to know who, quote, needs to be counted. Okay. So after AAI and ADC suffered these losses, and there was not inclusion in the 2000 census, they sort of wised up and really sort of thought about what kind of movements can we help sort of put forth to increase this awareness of this issue. And so some of you may have been too young to remember these and other of us are not. I remember these movements, but basically there was a movement before the 2010 decennial census that essentially really promoted this notion that Arab and MENA folks should not check white on the census if that's what they feel like if they feel like that doesn't describe them, okay? So you had these movements, check it right, you ain't white, and then yalla count, again, this notion of check it right, you ain't white, okay? And what they ended up finding in the 2010 decennial census, and so this is an example, or this is the actual 2010 decennial census form, that this was one of the first forms that had some other race. Okay. And in this form, what they found in the some other race category is that over 1 million people from Arab and MENA backgrounds filled in some other race. Now, you might be like, oh, is that a big deal? Oh yeah, researchers don't get people to fill in stuff. That's a big deal, right? So the census then was like, oh no, oh my goodness, our form's not working. We need help. So they hired this amazing woman, her name is Rita Stefan, to be the Arab ancestry expert for the US Census, okay? And she's no longer there. She was working at the State Department for a while. But she sort of brought all of us in that have done some work on identity and measurement to inform the census on how they should go about trying to collect data with these groups. And so this was a really huge moment in really truly moving forward some of these efforts to try to get an Arab MENA box, right? Because the census doesn't care about your identity. They don't. They don't care about if it's personally meaningful to you. They actually only care if it's accurate to you, right? So they are not in the business of racial or ethnic identity development. They just want to know, is the label right, okay? So what ended up happening was this set a whole bunch of things in motion in which a group of us were meeting with census officials and we were arguing, is MENA a good term? I don't know. It's making Arab invisible. And so we're trying to figure out, okay, what is it that we should be called to be counted? And I remember one thing that was said that actually irritated me. This is like a sidebar during one of these gatherings that someone was like, we had worked so hard, people like decided on MENA because then it includes Arab and non-Arab folks and Iranians and Turks and Armenians and other groups, right, that typically aren't counted. And we were like, woohoo, we're so excited, we worked so hard. And then some guy was like, MENA, I don't know if I like that term because it sounds MENA. I was like, are we serious right now? So anyways, there's always detractors, but the point is that not everyone really liked the term MENA. And frankly, you know, MENA is a colonial term, right? Middle East is a colonial term. It is problematic. And just like Dr. Kia-Keating said, not only is race a social construct, but all of these different labels are really socially constructed by powerful folks that sort of decide how they're going to label people, right? And so you decide, are you working within the system for a greater good, or do we, you know, and this is just a longstanding philosophical discussion that I'm not going to get into here, but we are aware that these terms are problematic in some way, shape, or form. So one of the approaches that the US Census really wanted to move towards in 2020 was to have a combined question approach to answering race and ethnicity. And this actually makes a lot of sense in terms of both including like pan-ethnic designations, as well as a pan-ethnic / racial, and then specific like ethnic or group or ancestry designations, right? And so it allows for both, and they have like these write-in options, and they've sort of, we're trying to figure out how can we just change the census form to be this just permanently, but then also how do we make sure that we're including groups that have not been typically included, okay? And so one of the things that I think is really important is that the census needed a lot of convincing about whether or not to actually do testing on including a MENA box or changing the Latinx, Hispanic, Chicano box, right? From an ethnicity box to a streamlined race ethnicity question, right? And one of the things that's really cool, when you know people in important places, they can give you some insider information. And so my friend Rita, who worked at the census, was like, here, I'm gonna front you this form, this combined question approach form to test in your study. I had just gotten a grant to look at discrimination, mental health outcomes in Arab and MENA groups. And she's like, I'm gonna front you the form they're thinking about testing. So I ended up putting this form in my study, and I tested 3 different versions that had an Arab and MENA box, okay? And in one of our gatherings, they were trying to figure out, well, is this question even important enough for us to put our resources, the government resources, into testing, okay? So luckily I had data from my study that showed that 87% of people, of Arab MENA folks that got this demographic form clicked the MENA box, okay? And the other percentages were usually individuals that like were of Pakistani descent or whatever, for whatever reason, it's just sort of different. But about 8% checked white when a MENA box was there, okay? And so that was compelling enough evidence for the census to say, okay, I think we can include this in our national content test, okay? So this is a really good example about individual researchers making a difference in policy type testing. And a national content test costs $7.8 million to conduct. So they don't want to do it lightly. They need to have a good reason, right? So this is an example of one of the forms that had MENA on it. And so what they did was and I'm sorry, it's blurry, they included the largest Arab and MENA groups represented. So in this one, they had Lebanese, Iranian, Egyptian, Syrian, Moroccan, Algerian as like the largest numbers for this particular form, but they tested permutations of this, okay? They even had this cool version that's filling out the census on your phone, where you click, where it's just sort of big categories and so on and so forth. But once they sort of went through and had these data put forth from the National Content Test, essentially what they found was that when a MENA box was there, people from MENA backgrounds clicked it. This was a key important finding, right? And because of this finding, the US Census suggested to the Office of Management and Budget that we need to add a separate MENA category on the US Census for 2020, okay? So there's usually a myth that the census is against us. They don't want to include us. The census wants a MENA box. It's not the census, it's Office of Management and Budget, okay? So fast forward, we have all this amazing data. They had public comment, everyone's in favor, yay, MENA box. Then Donald Trump gets elected. OMB is in the hands of another person. They purposefully stalled making a decision on whether or not to include a MENA box and missed the operational deadline for being included in the 2020 decennial census, and we have no MENA box. So all the research that was done essentially thwarted for political reasons. Okay, so this is where politics and research sometimes collide. So in 2020, what ended up happening was that they're like, oh, I know that you all are upset, but we'll include your group. We'll include them as examples of white. So then they add Lebanese and Egyptian to the white category, which people are like, are you kidding? No, that was, you meant, no, that, However, what was good about the 2020 census, and I'm actually really excited to see these data, is that for the first time, they have country codes for all of these write-ins so that we can actually get numbers of MENA and Arab folks for the first time ever on decennial census from sort of the large data collection of population. Okay, so I'm saying all this because I want to give you the background of all of the work that people have sort of gone through to try to get recognized. And so exactly like this amazing student committee pointed out, we can't wait on the census and the Office of Management and Budget to include this box. We need to do this ourselves. We need to have movements. And I've been working with a national group to sort of do this apart from the US Census. And US Census folks are on those groups, but to essentially go to states and try to have states included in their data collection and sort of work up. But the options of how you can do this, how you can add a MENA box are great, right? And so as part of the Access Research Collaborative that includes a lot of scholars, but the four listed here, we currently have a paper under review to sort of highlight this, to help sort of put this out into the research literature. But you can do it in a lot of different ways. The streamlined approach, where you just add a Middle Eastern box and have a streamlined approach. And again, these can look different based on the context in which you are collecting data. So for example, if you're in a particular situation in which you know there's a large Chaldean population, you can actually add a Chaldean checkbox instead of a write-in so that people can just click that, right? So you can also take this form, adapt it for your own particular research, populations, or context that you're using, okay? The second option that we essentially promoted was this notion of MENA as an ethnicity box. I'll be honest, I don't, this has some problems with it in the sense that you check a MENA ethnicity, but then it's similar to the Latino Hispanic box, which is you then get to the race and you're like, you're still clicking some other race, or if you don't, or whatever race you feel like is appropriate. But oftentimes for Latinx groups and MENA groups, it doesn't make sense. They feel like they've already filled it out with the ethnicity. So this has its problems, but this is also another way to essentially add a box that would be similar to Latinx, Hispanic category. And the third way, honestly, is just add a box. I don't care, just whatever you do, and it doesn't really matter. Just put something on your demographic form that has this group represented, right? And so we need more data, and the way we get data is to collect it, right? There's some amazing movements that are currently being done. The University of Michigan Healthy Mind Study that is sort of given to many colleges and universities all across the country has incorporated an Arab Middle Eastern category on that particular survey. And now we have thousands and thousands of data points on MENA college students and their mental health outcomes. And so this is, so we see some bright spots, we see this being used, and we just need to push this forward. So I'll stop there since I'm over time, because I don't usually listen to prodding of stopping. So anyway, but I'm happy to field any questions that you may have.
Thank you so much, Dr. Awad and Dr. Kia-Keating. So we will go ahead and move into the question and answers portion.
It just says if we want to be entirely inclusive, wouldn't we just use the term MENA as all-encompassing?
Yeah, so I'm going to tell you why I did not do that in my presentation, since I'm the culprit here. And I think that there is, in some cases, a purposeful trying to erase Arab heritage and culture because of a pejorative, more of a pejorative thinking towards Arab people. And so in my research a long time ago, have always said Arab and MENA from the start, so that it's inclusive for Arab folks, but also for Iranians and like Copts and Chaldeans and other non-Arab MENA folks. But the Arab part is part of the racialization of MENA, period, whether or not you identify as Arab. And so that is why I specifically make the choice to say Arab MENA, even though, you know, ancestrally, like I am actually technically not Arab, right? So because I'm Coptic Egyptian. So I want to just say that I make that choice even as someone who ancestrally wouldn't identify, but I see in my writing and my work that people are essentially like, oh, like you might. So I just published a study in 2021 about why people pick Arab and MENA, and why would they pick Arab? Why wouldn't they? Do they think Arab is a good term? And there's a lot of reasons. And the number one reason is that when people don't identify as Arab, it's because it's not the right term. It's not accurate. It doesn't make sense. It's not, it's not accurate, right? But there's other reasons, and people will be like, oh, I'm not Arab. Ugh. And that to me is a problem, and I'm not going to contribute to that. And so that is why, and AMENA-Psy is called the American Arab Middle Eastern North African Psychological Association for that reason, because I think Arab really recognizes the racialization of all MENA people. So that's my answer.
I can just add to that we, as I said, I really see all of this as hopefully something that we're evolving and continually looking at ourselves and trying to update and change, and there's no one right answer. So in this moment right now, this is the best answer a lot of us can come up with, but it doesn't mean that we shouldn't understand the past. And that's part of why I brought up the early legal history, because there's a reason our older generation might be more stuck with wanting to still identify as white, frankly, because there was actual impact in, up through 1952, right? To become white meant you could become a citizen, you could become naturalized. So there's a reason why you want to fight for that. And so to ask that older generation to make a shift was a big deal, or maybe still is a big deal. And so anyway, we have to understand where we came from. We have to understand what we're trying to do right now. And I hope that we can begin to share in a vision for the future that, is undetermined, but perhaps there's a better way in the future. But for right now, we're doing our best, but we're also still open to conversation and evolution together.
Thank you so much. So the next question that we have is, where is the APA in including MENA in accreditation? And what are the next steps to get MENA included in APA?
Another question we have is, do you have any guidelines for deciding when to broaden research on MENA or more narrow research on particular national ethnic groups in research on psych issues within our communities. There isn't much research on MENA to begin with, so I'm inclined to use MENA, but I'm also wondering if there are any situations where within group differences might indicate use of a more narrow category.
I have typically, like I said, have put Arab, Middle Eastern, North African, and had all of the terms that are the most inclusive in like one line, like slash this, so that you can see yourself represented. But when I recruit broadly, and then I also allow people to put their specific ancestry and ethnic group. So for that very reason, with the hopes that I will have enough folks sample sizes to actually do analyses, but people do this all the time. So for example, in Michigan, you know, there's work that specifically is done with like the Chaldean population or the Yemeni population, and it's just data collection with those groups. So I think it would be similar to any group that, you know, you can choose to, you know, think about specific ethnicities within a pan-ethnic designation based on your research questions. So I think that's just, you know, a good way to go, especially if it makes sense for your research.
Yeah, I think it really depends on methodology and what your research questions are and your approach. And, you know, if you're doing a nationally representative sample, you might, well, you might have the two questions so that you could potentially look at the more detailed level, but have like an item I would recommend, you know, because oftentimes you just don't have enough in a sample to look at statistical differences. You don't have enough power if you really break it down too far. So you keep kind of your general race ethnicity question that has a few categories, and then you have more detailed so that in case you can look at that data, you have it. And then I would say that a lot of my research is also participatory, and you work directly with the communities in that approach so that you can really hear from them what they want. And most recently, I've been working on a project with a number of refugee groups, and some of whom probably, well, could fit under a grouped umbrella category. But in fact, one of the groups, I won't get into all the details, but one of the groups felt very strongly. And because we're using a participatory approach, they were able to express that they wanted to be individually looked at and talked to. And they really felt like our experiences are unique and we need to have a unique perspective accounted for and created. And so we're responsive to that because we're working in partnership with the community. And so I would say, you know, different kinds of research have different ways of being able to do that. And you know, there's a place for all of that.
Thank you. So the next question states, Dr. Awad discussed Middle East as a colonial term. I'm curious as to why SWANA is not used to resolve that issue, Arab and SWANA, for example.
I think, so I will just answer from, in terms of my work and my advocacy work on this. So I have been working for many, many years to get a MENA box. And it takes a long time to just decide with a group of people, as you I'm sure know in your own lives, to come up with a term that people like. And MENA is not perfect, but it's the most inclusive term. And it is the term that is what I would think of as orthogonal to other terms. So Southwest Asia is actually a problem at the census level because they're already included under the Asian pan-ethnic designation. And that's why, like, if we make that, if we try to make that argument to the census, they're like, this is overlapping, it doesn't make sense. And they're coming from a research science perspective on like, what data do we need that we're actually missing? So I understand certainly from like grassroots advocacy perspective of wanting to use non-colonial terms, but in terms of the pragmatic aspects on the federal level and moving things forward, it just isn't the term is not orthogonal. It's not mutually exclusive enough to actually work on a federal level. So that's why it isn't really about like, I think MENA is amazing. I don't know if anybody felt like amazing about the term MENA, but I think they just felt like it was the most inclusive.
Thank you so much for answering these questions. These are some really great questions. And I just wanted to give a heads up to everybody that we have about 10 more minutes of questions and we have a few more to go through. But feel free to add your question just in case we have some time, and then we will wrap up in about 10 minutes.
Another question we have is, how can I recruit MENA participants, and how can I learn about issues unique to this community so that I can contribute with my research?
So I think it depends on, so I would say anytime you do research, collect this box. Always collect these data, right, on anything you're doing. So that's number one. But I mean, it's really hard to collect data with MENA folks right now because we don't have, because of the lack of recognition, right? And because of the lack of recognition, like Dr. Kia-Keating mentioned earlier, some folks, they see the box, are like, what's MENA? I don't know what this is. And they might not even check it because they haven't also been socialized, because they never see themselves on demographic forms. They look for the other category, or if there's no other, they just say like, well, what do they say I am? I'll just click it. And you have folks that, do that. So there's also some socialization that needs to happen also within the community about using these boxes when they're there. So, it's going to be difficult. It's not impossible. Like, there are those of us who've done research with this community. It just, the data collection takes a long time and you have to be really patient. And you reach out to all of your networks. And so much of the data collection is through snowball sampling, because we don't have any kind of systemic way of getting it at, to use like stratified sampling strategies if you want like to have more generalizable data. So we're slowly building there. So I would say Healthy Minds study is the best example of, it's included in data collection on this national level. And we have a lot of great data points for Arab and MENA folks. However, that's college samples. So we're building. And there have been more movements to work with state government to include it in their health data collection and their educational data collection. So there are small movements of those of us that are working to advocate with in advocacy efforts with state government entities to include it. So it's slowly but surely, but it's not impossible. You just have to be patient.
I love that answer. And of course, just start by adding that box, right? And you already have the item. Like, almost everybody always has an item about race, ethnicity. So literally, you don't even need to add an extra item to your surveys. You're just adding a extra box. So that's a starting point. But, I always also encourage collaboration. Collaborate with your MENA colleagues, find them, look for them. And you've seen a lot, met a lot today. And so collaboration. And the other piece that I of course love, and I'll just reiterate, is participatory work. So actually engaging the community in that question will open the doors to recruitment if that's the issue, because there's no one better to tell you how to recruit from a community than the community itself.
And as a follow-up to that, we're getting some great questions about finding ways to include MENA in clinical training and psychology departments. So people are curious about the best ways to attract the attention of individuals in academia and how to convey the importance of including a MENA category in research and DEI efforts.
That's a great question. I think we probably, as an organization, AMENA-Psy, could spend some time thinking about ways to use this as a foundation of a conversation and to then take it to the next level. Because I think that's going to take an effort, and there's probably multiple paths that are necessary to really engage in that conversation, figure out the context and ways in which to do that. And it's unfortunate that it wasn't a category in the census, because it hurts our conversation because we're not able to just drop the data, and it's not going to be an automatic, easy, here's the census question, let's just put that in our data. So we have to do a lot more grassroots work in that direction. But if you have suggestions, don't just ask questions, throw suggestions in, put some suggestions in the chat, or join AMENA-Psy and participate.
Yeah, that's an excellent point, Miriam. I also, Dr. Kia-Keating presented the race and ethnicity guidelines. Send that to your chair and say, you all are not in compliance with what APA even says that you should be collecting. Because in those race and ethnicity guidelines, they talk about collecting data with MENA populations. And so it's just like, stay up with the times. This is what you need to be doing. I don't know if this, here's the report. It's like, I don't know, 90 pages. I don't, there's multiple versions of it, but you can also send them that. Like in psychology, here are the race and ethnicity standards. So I just want to help this department meet that. Yeah, so I think you can do it that way. It's always good to have documentation, evidence, research. So anyways, that's what I would do.
And are the 3 suggestions, are those on the AMENA-Psy website? Maybe the 3 ways that people could add this category to their research. If it's not on the website, maybe we can add it or put a link in the chat so that people have easy access to that.
Yeah, that's a good point. I think it is, if it's not, I don't think the 3 ways are on there. I think the 1 line is on there, right?
We have 2 points on the one pager that we included in the WeAreMENA page. And so you can go to the amenapsi.org/WeAreMENA and download a PDF that we had created that has some really useful information and it's detailed on how to include MENA.
I think we have time for one last question, maybe. Question is, are there any other racial ethnic groups in this country that have similar barriers to being counted? This feels unique to MENA communities, but I'm curious if there are any other parallels.
So much for answering those questions. I know sometimes they can be loaded and really difficult to answer kind of simply. So we really appreciate that, Dr. Awad and Dr. Kia-Keating, for your time. And I want to just give a few minutes if Sarah had anything to say as well. But just to plug in, I put it in the chat, but chat's been hot, at least mine is. And that the AMENA-Psy conference is this year, the 2nd annual AMENA-Psy conference on September 24th and 25th. And if you're interested in learning more about MENA psychology and the research that's happening in the area, we really encourage you to attend. You do not have to be identifying as MENA. You don't have to be identifying as MENA to join the organization as a friend of AMENA-Psy. The more allies we welcome and invite you, so that'd be super awesome. And you can find a lot of information on our website at www.amenapsi.org. And with that, I will hand it over to Sarah.
Thanks so much, Bahar. I think you concluded it so lovely. Just wanted to really just a big heart, thank you to our speakers. Thank you for sharing so genuinely of your own personal experiences, all the research and the work that you've done. It's truly incredible and inspiring. And I hope everyone today is leaving inspired. I hope everyone today is feeling a little more empowered that, we can make some really big change on a community level. It can start with us. And if we start sharing things, if we start advocating, that it can grow really large. And so please share all of the social media posts, continue to advocate for the campaign, and also connect with us if you're interested in getting involved. And with that, I hope everyone enjoys the rest of their Friday and has a lovely weekend. Thank you.
Thank you, everyone.